Hi, welcome to the Recovery Daily Podcast. I'm your host, Rachel Abassi. I'm a grateful recovering alcoholic and stroke survivor. And today I want to complain, and I have a right to do that. I just want to complain about health insurance. And you guys know it's been a long battle with stroke recovery and having to do all of the background work, paperwork, doctor's appointments, all of these things in order to get insurance to approve things and not be a blocker. And so yesterday I got a call from my cardiologist. And I had been scheduled for a loop recorder for October 8th to get it implanted. It's a heart monitor and it's implanted under the skin, and they can monitor you for like up to 3 years or something like that, I think is how long the battery lasts. I had a heart monitor like that's attached, stuck on the outside of you. I had that in 2021 after I had my stroke to like make sure that I don't have AFib. And so I had that for like 2 weeks. I had that hooked to me. I did not have AFib. I clearly remember the entire experience. Anyway, in order to get the loop monitor implanted, which is just, they say that the temporary monitors that last like 2 weeks don't always pick things up, you know? I mean, isn't that just the way that you're suffering from something? And in the 2 weeks that it's being monitored, you don't have any of the symptoms that happen. So, and some people have AFib and they don't even know it. So they had scheduled for me to have this loop monitor. Well, yesterday my doctor called and said that my insurance company denied the pre-authorization. And it's just so aggravating to me whenever I get anything denied by my insurance company. We pay for our insurance. It's like it's like long-term disability and short-term disability. Like I pay to have that waiting for me if I need it. And yet you have to jump through hoops in order to actually use it. So when he called and said he was actually aggravated for the both of us, he actually cursed. He said the F word, which I've never heard a doctor say the F word, but it made me feel like he really cared. And I need to take my jacket off because I'm having a hot flash. So anyway, he said, let's do the external heart monitor again for another 2 weeks, and then we'll have what we need in order to get the heart monitor implant. So I'm like, fine, that's fine. So I get off the phone and I'm like, I could just feel my aggravation building that insurance companies are more of a blocker for me getting the health care that I need as a stroke survivor. It's like the last thing that these people need who have suffered a stroke and getting blocked by their insurance company. It's fascinating to me. And I've heard so many other people struggling with the same thing. And I don't really talk much about it because I don't know, it's kind of like complaining about something, but it's never going to change. Complaining doesn't do anything. But I thought it's probably important for me to share what my experience is like in case there's other stroke survivors that deal with the same thing, to understand that it's not just you. It happens to the best of us. So I wanted to talk about that. And I haven't had any issues with insurance as far as when I had to go to when I got to go to detox. Both times that I went, I didn't have any issues with insurance, but I imagine that there are folks that do have some things that happen like denial and stuff. I would presume that a lot of us don't get sober the first time we try. And I don't know what the threshold is for insurance companies to pay for things like rehab and detox if you happen to be a relapser, meaning you had started drinking again multiple times before you actually were able to stay sober for a long period of time. And I have had another woman in my sobriety network who was relapsing, and she did get denied finally from her insurance company because she just kept going and kept drinking afterwards. So um, this is just my current battle with the pre-authorization for the loop monitor being denied. And I think the frustration about it, it's not so much that, yeah, it's a little bit of a pain to have a heart monitor hooked to you. So I have it hooked to me now. We had because the insurance company decides that I haven't gone through all of the tortures that are required for me to go to in order to get the loop monitor implanted. I needed to go to DC today in order to get this one stuck on me, this heart monitor stuck on me first. So we go to DC, which, mind you, it is really triggering for me to ride in the car. So anytime I have to go to a doctor's appointment, it's a big deal because I need to close my eyes the whole way in the car. And then it's a guaranteed I have to sleep the rest of the day when we get back. And that's what happened today. So because the insurance company decided that, okay, yeah, she had a heart monitor in 2021, but I don't know, maybe they thought it hadn't been soon enough since that to say I needed a loop monitor. No idea. But they decided to deny me. So, because of that, I had to go to DC. And that means that I have to go through all of this kind of like light torture. So I've got it on. It's frustrating. There are ways to appeal when the insurance companies deny you, but there is like what is it worth? Is it worth the aggravation? For me, it's like to do anything, I probably have to go online and find all of my records, which is also triggering for my head. And it makes me quite often think about the stroke survivors that, that haven't been left with the abilities that I have. I have a lot of things that I can't do, but sorry, there's a spider. I just found a tiny little baby spider. That's unacceptable. Sorry, spider. But there are people who have been left with a lot less capabilities than me. And it's just really frustrating to think about these people unable to care for themselves being required to go through all of this in order to appease their insurance company. It's just so frustrating to me. So, but my husband reminded me of how hard it is for doctors, because doctors are advocating for their patients. They're recommending treatments based on the medical history of the patient, based on their sorry, I lost my train of thought. Based on the medical history of the patients and their best guess. I mean, honestly, that's what it is, the doctor's best guess. So as much as I have to deal with the insurance company every time I go to the doctor and this long-term insurance and all of that stuff, doctors are dealing with it all day long, dealing with denial of coverage when they're trying to prescribe treatments. And all that's doing is slowing down recovery for their patients. And I imagine that that's probably why my doctor said the F word yesterday. Um, so, yeah, I've just been thinking a lot about it and I wanted to share about it. There are lots of people that I've run across online that are talking about how difficult it is to get the care that they need. Either it's because their insurance company denied them outright for things, or that they're going through like physical therapy or speech therapy and they have a limited number of sessions that they can attend in a year, and then insurance doesn't pay for it anymore. Well, what if you are not recovered at that point? I went to my vestibular therapy for 6 months and I barely, barely scratched the surface of doing any sort of improvement at all. I mean, the greatest thing that it did was give me more courage to like lift my head up and not be so afraid that I'm going to be having screaming pain or something like that. Like, I still go outside. I just was outside walking my dog this evening and I was doing my vestibular exercises. So I do all that stuff to maintain my status as far as my symptoms and everything. And my insurance company was going to continue to pay for it. I personally felt like I wasn't getting enough out of it to be dealing with that twice a week. The amount of suffering, I would say, that I had to deal with to go to the physical therapy once a week or twice a week was not worth it for me. I would rather be given the homework and do the homework every day than to have to keep going in there. And because it's the drive in there that's the worst part. It's not the actual therapy. Unless I started doing the thing where they hold up the board of letters and I have to like find the letters on the board, and that made me cry. Anyway, not funny, but uncomfortable laugh. That's what that was. So, again, yeah, alcoholism recovery, there are insurance companies that frequently limit addiction treatment coverage, offering like short-term rehab, but not long-term support. And we know as recovering alcoholics that alcoholism is a lifetime disease. It's not something that requires short-term rehabilitation. It's something that needs lifetime support, honestly. And thank God that Alcoholics Anonymous is out there and it's what do they say? $1 million worth of therapy, $1 at a time or something, one day at a time. It doesn't require money, contributions are requested, but not necessary in order to get the support that you need. So, what can we do when insurance companies are denying us? There's another woman that I is in my network on Instagram, and she was denied Social Security coverage, Social Security disability coverage. And and it makes me sad to it makes me sad because her reaction to that was the same reaction that I had whenever I was feeling like they weren't going to cover me, either Social Security or my private long-term insurance. Like there was a period for you longtime listeners, remember, there was a period where my optometrist put the wrong information on my paperwork to send to my long-term insurance company. And the long-term insurance company called me and said that they were going to deny me long-term insurance because the doctor wrote on the form that I didn't have any problem. I could drive fine. Yeah, there's nothing wrong with my vision and all this stuff. I'm like, what in the world is happening? Like, is this bizarro world? I have gone in, like, I have been suffering and pain. And this guy filled out my paperwork, this doctor did not take the time to fill out my paperwork right, and my insurance was going to deny me for it. And I don't necessarily blame them for um, being about to deny me because that's what the paperwork said. So it's really some of the doctors actually get so busy and don't maybe think about the fact that our lives are in their hands. Even eye doctors, my life is in your hand. You're just an eye doctor. My life is still in your hand, no matter what the doctor is. It's not like you have to be a cardiologist to be really important in our lives and make sure that they take the time that they need to fill out the paperwork right. So if you get denied, appeal the insurance denials. And I know that it's time consuming, and I thankfully have not had to actually appeal anything yet, but I did have to work. I was about a week from getting denied. And I wouldn't stop picking up the phone and calling my doctors and having them send me letters and information that I needed to send to the insurance company during that week because it was just unacceptable. Like I had to take action. And that's what sucks is there's a lot of emotional turmoil with all of this. I'm already teetering on depression. So to have an insurance company deny you is just mind-boggling to me. And this woman who just received a denial from Social Security disability, she actually had to get go to a facility for mental care because she was so bad off after getting her denial. She had her stroke about the same time that I did, and she went back to work just like I did. And she stopped working about the same time that I did. Her deficits are completely different than mine, but she you know, she has been in pain and struggling just like me. But there is a difference. I don't know further than that. I don't know what she didn't do that I did do that got her denied and me not denied. But it's so easy for these insurance companies to send denial letters and just move it across the desk, stick it in the stick it in the bin for the mail person to come pick up. It's so easy to do that and not really think about this person on this paper as a real human being who might not even have money to live now because they can't work. They are getting denied by insurance. Like, what do you do? Especially if you don't have family or friends. It's just terrible. It's just terrible. Um, so putting in the time to appeal is absolute, and it's like I'm trying to think. I'm having a hard time thinking of words today. Like, don't rest until you've done everything, filled out all the paperwork. It's not like, okay, print out the paperwork and then I'll fill it out tomorrow. It's like, fill it out today and then work with your doctor. Like, I have had mostly good results working closely with my doctors. The problem lies in that most of the time, when we as patients are calling our doctor's office, we're talking to the person at the front desk. And that person at the front desk is not a medically educated doctor or nurse or anything like that. They're somebody who has been hired to work the front desk. And um, they don't necessarily have the empathy for patients. They may not even like their job. You know, they certainly didn't have to put the kind of time in that a doctor would in order to acquire that job. You know what I'm saying? I mean, I'm not trying to diminish people who work at the front desk for places. What I'm saying is that they may be in the wrong field because they may just not have the compassion for who they're talking to on the phone. And I dealt with that. I mean, I've called many places and either they don't call me back or they're just like nasty. And I think that they just forget that they're dealing with people who could have died, you know? Um, there's also a lot of resources available online. There are advocacy groups, and I absolutely would recommend support groups because they're not just there for talking through these kinds of issues, like any issue that you have as a survivor, but they also are most often supported by medical professionals that are there to support you if you need help navigating insurance issues or you need help figuring out your paperwork. They are advocates for the people that are in their group. So appeal your denials, work with your doctors, like be that annoying person, be that squeaky wheel. That's what I had to do. I don't like being the squeaky wheel. I like being the quiet person in the corner, but um, you got to stand up for yourself. And I've learned that much more as I get older. Maybe that's why older people start getting grouchier because they're more willing to advocate for themselves. And then I think what's important for all of us is to be the voice about these kinds of issues with, like if you are interested and you have contact with local representatives and advocacy groups and the like I urge you to push for policy changes and advocate for change around this stuff because it's really, really difficult. It makes something that is already life-changing and sometimes feeling like it feels like your identity has been 100% lost. And to have somebody questioning the authenticity of your sickness at a time when you feel your most vulnerable is honestly disgusting to me. It disgusts me. Um, the stress that is involved in stroke recovery is beyond any stress that I dealt with in my job before I had to leave my job, because this stress is 100% directly related to my existence, my physical, mental, emotional, spiritual well-being. And that's why I'm so adamant about doing whatever I have to do in order to advocate for myself and try to talk about it and help you if you happen to run across something similar. So having resilience in that respect and recovery is a whole other challenge, that we are faced, that's created by the insurance system. Um, so I want to remind you that you do have the power to advocate for yourself and push for the care that you deserve. And it might get messy. There might be people that you talk to that either don't give a shit or they've got their own problems in their private lives. It doesn't matter, Don't let anything stand in your way from getting the care that you need because you deserve it. And I want to offer myself as um, a supporter if any of you have questions about insurance and how I managed mine, how I was able to go from short-term disability insurance to long-term disability insurance to Social Security disability. Um, I'm proud to say that I have navigated that entire journey and that right now I'm in a spot where I'm fine and everything will get re-reviewed again in sporadically. There's a different schedule that all of them are. Well, the long-term disability company said that they're going to review me again in 2025, and then the Social Security disability said that they will review me again in 3 to 7 years. So I don't know where that will lie, but it is important for me to continue to make sure I'm documenting everything, make sure that I'm always methodical about my care, making sure that I'm doing these things like getting my heart monitor. And then next I'll get my loop monitor. So I'm continuing to look for, and I may have not covered this, why I had my stroke. That's what all these monitors are for, is they want to see if I may have AFib. So they're just gonna keep testing my heart until they find something. And if nothing is to be found, then um, the jury is still out on why I actually had my stroke, which is unsettling, but it's really nice to have doctors that are listening to me now and willing to go the extra mile. Like, let's hook her up with this. We're going to have her, as soon as I started going to MedStar in Washington, D.C., at the Lafayette Center, I have had progress in not my symptoms changing or necessarily my recovery itself, but I have had more doors open up for support. So now I have a specific headache specialist, I have a specific stroke specialist, and I have a neuro-otologist, which I'm working with to try out some medications to see if that helps with my headaches. Nothing yet. I did take the new medication for 30 days and it was 10 milligrams. It hasn't done anything. So for the next 30 days, we up it to 20 milligrams. So we'll see what happens. Anyway, yeah, I want to extend my support to anyone who may have a question. All I can do is share with you my experience, strength, and hope, and just help to push you to fight for proper care. And that's even when insurance companies can create roadblocks for us. So keep advocating for yourself, working with your doctors, working with the community. It's really great when you can reach out and try to find people who are dealing with the same illness, disease, deficits that you are dealing with. And I've certainly found quite a few little communities. I've got my vestibular support community, I've got my stroke support community, and I have my group of drunks that I love so dearly that I meet every morning. Two groups of drunks every morning that I meet online. So recovery is hard enough for sure. So don't let the insurance healthcare system thing stop your progress. Like, keep showing up for yourself, keep fighting for yourself, even when it gets hard. And it does get hard. It gets really, really hard. And it made me want to give up, but that wasn't an option for me. So keep coming back here, and I'm always here to try to help as well. Thanks for listening, and I'll talk to you tomorrow.